today we're talking about dry needling and how it works and what you're going to feel and what you'll experience and why we do it. It's actually one of the most amazing techniques that I've come across because the dry needling helped me become totally pain-free. It was using a technique called IMS, intramuscular stimulation, so you get different types of dry needling. You get dry needling, superficial dry needling. So dry needling is using acupuncture needles, so that's where the people start freaking out because they think it's acupuncture. No, it's a totally different technique. You've got a short needle, a medium-sized needle, a longer needle, and a very long needle, and they come in different lengths. I prefer these lengths because I don't like too short and I don't like too long, but I like working with these lengths of needles. So this is a 100 ml needle that I'll use on buttocks, especially large ones. This is the 75 mils, which is most people's buttocks. This is your lower back and your neck, and these are 30 mils are for your thoracic region. If I do not have 30s in stock, I will not needle your thoracic area, because if one uses a longer needle in that area, you stand to compromise the area and you could actually puncture the lung, causing a pneumothorax. So we don't want to do that, so I'd rather just not needle. So how the needling works, and I'm actually going to show you how to needle on myself. I don't mind. I've gotten quite used to it. So you'll have a little spigot, a little blue thing that we take out, and then your needle will be in a little tube to help us guide it in. Now the key to getting this needle into your skin without you feeling it is to tap it in through the tube. So the needle is slightly longer than the tube itself. So when I place it on the area and you'd place it on the trigger point, you'd step it in. I felt nothing there. Okay, it's not painful when it goes in. If you do feel it stinging like a bee, or like one of my patients says, chilly in the back, it means that I've hit either a blood vessel or a superficial nerve. It's not a problem. We just take it out and do it again. And then down we go. As you take it in, you see I'm guiding it slowly down into the muscle. And what one does feel then is a deep aching sensation. If I haven't quite got the area right, or that muscle isn't really compromised, you won't feel much. Okay, but otherwise you'll feel a deep aching sensation, and it is usually the pain that you are complaining about. So I'll elicit an ache and then you'll feel your headache coming on, or I'll elicit your back pain and then you'll feel it referring down your leg, or your buttock pain and you'll feel it referring down the leg. If I don't quite get the area, it will still be effective, but not as effective as if I've got it spot on. So if you come in with a migraine and I can get the needle in the spot that you see, oh, my headache's getting worse, and I can feel the migraine like I'm wanting to die, I can often put in a second one quite quickly next to it to deactivate the muscle spasm, and your headache can instantly go. It's quite miraculous, really. I had a lady that came in, and she actually came in a wheelchair. This was when I was working in England, because you can't get a wheelchair up my path. And she was unable to walk, she was unable to bend forward, so I couldn't even really evaluate her and do all the movements and tests. And I could only stick 2 needles in her. So I picked the spots that were the ones that were causing the area. I stuck the needle in her. She had the needle in for about 10-15 minutes is what I leave the needles in for. And then I took them out and she stood up and she could bend and touch her toes and her pain was totally gone. That is absolutely amazing. Now, as you can see, you don't really want to move the needle, because if you do move your arm and stuff like that, it is quite painful. So when you're on the bed, you want to lie absolutely dead still, because also if it's in a chest area and that, and you're wiggling around and moving around, the needle can move and actually move into the chest, which again is why I only use the short needles in that area, and could puncture your lungs. Needling is quite dangerous in the scheme of things if you don't quite know what you're doing, so you must go to a person that's registered and knows what they are doing. You do get several courses that teach you how to use the needling technique, and because there's loads of complications that you can get. Now, the effects that you have from the needling, apart from the deep aching sensation, is if I stick it in an area that is holding emotion. So when we are going through a traumatic experience and at the simultaneous time we have an injury to ourselves, that area will go into a spasm, but the emotion linked with that traumatic event will be stored in that area. So if I stick a needle in, the patient may start crying for no reason. They're not crying because it's sore. They'll just say to me, I don't understand why I'm crying, I'm just crying. And it's because the emotion has been released, because the muscle's been released. I've had that quite a few times. The other things that you may experience is if I've done a lot of needling on you, or some people that are extremely sensitive, you can get shaking. So you'll start to shake it like you've got Actually a parasympathetic effect. It's the release of the adrenaline, and now you're going into the reset phase where you have to shake to get rid of the adrenaline, and then your body will calm down and you'll be perfectly fine afterwards. But some people do get a big fright, and I've had several patients that have refused to get the needles because previously when they've had needles at other people, they've gone into this state and they felt like they were dying. So it's not a very nice experience to have, but if you understand what it is about, I usually laugh when I see it because I know I've hit it perfectly, and now you're going into the healing phase and you're over the trauma of what has happened to you. So let's just take this out so I can show you how to take it out. You usually take it out with a little toilet paper or tissue and stuff like that, and just in case it bleeds. Most of the time it doesn't bleed. I'm just going to put the needle there for now, but we do have to dispose the needles in, we call it yellow boxes, or sharps boxes, and those boxes need to be disposed of at hospitals, and medical suppliers that actually supply the boxes come and collect the boxes from you, and then the needles get burnt. So they're one-use needles. We will not use these needles again. So each patient gets a new needle that has been totally sealed and fresh and not compromised with any diseases or any nasty thingy-mabobs. So we get that, and then when I'm finished, I will dispose of that needle totally, and I put these plastics into my plastic collection paper bag here, and that gets recycled. So so the other symptoms that one can experience after needling would be, we mentioned the shaking. You can have extreme bouts of sadness, so you can cry. You can have extreme joy and be overwhelmed and just want to like spring clean a house. You could be extremely tired, where you just want to sleep. Some people can't even make it home. Some people need to have somebody bring them to treatment and drive them home because they fall asleep behind the steering wheel otherwise. So if you've never experienced needling before, do try and bring somebody with that can drive you home. Also make sure you've eaten something before the time, because it drops your blood sugar levels, and you can feel quite unwell. It can also make you faint. That's one of the side effects of it. It can make you faint, especially if you're scared of needles. Some people are so scared of needles that they refuse the needling technique, and that's actually quite detrimental for their healing process, because the needles are one of the most powerful techniques that I've come across that actually can heal chronic pain, your fibromyalgia, your chronic whiplash injuries, your disc lesions can be improved, and surgery can prevent it by using needles. So I then use a tapping technique called EFT, Emotional Freedom Technique. We'll talk about that another day. But what the tapping technique does is it helps to calm the patients down, because often the fear is unreasonable. There's no reason for you to be scared of needles, especially the acupuncture needles. I know a lot of people have had negative experiences with injections themselves, and injections are painful, yes. I've had many injections. And when it comes to a point where your pain is worse than your fear of needles, you can actually overcome your fear of needles. So I no longer have a fear of needles. As you see, I can stick a needle in myself. I can treat all the areas that I can get to. I've treated before with needles. Don't do this at home on your own if you're not qualified for it. But I was quite desperate at a stage when I had my chronic pain, and I suffered with the chronic pain for 10 years until I found a person that did the IMS, the intramuscular stimulation, on me. And that's an insane technique. It's where you needle the entire body in 45 minutes using a plunger. So you'll have a needle that it looks like a weird injection thing. So you'll have a mechanism or a equipment that you screw your needle into, and then it has a plunger that goes up and down and up and down. And what you'll do is you'll put it into the body, and then you'll go jab, 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 come out, put it into the body again, jab, 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 until your needle is blunt. Then you'll change the needle, and then you'll move on, and then you'll use again your different needles according to the different areas of the body that you've used. Now in that technique, the IMS designed by Professor Chan Gun, who lives in Canada, where I was to learn the course. I also do the IMS. You do the entire body, every single muscle in the body, in a 45-minute session. So when you get up there, it feels like you've been dragged through a bush backwards. You feel like you've been hit by a bus, and you have absolutely no idea what's happened to you. And when you get up, you're extremely stiff all over. And the key is to move, to get moving. So I had the IMS experience when I lived in England, and I had to walk a 20-minute walk back to the train station to catch my train back to my house, and then another 20-minute walk back home. So by the time I reached home, I felt absolutely fabulous, and I got the energy burst. So I wanted to do like a 2-hour aerobic session, which I hadn't done any form of exercise before because the chronic pain would prevent me from doing exercises. It was absolutely amazing. So I am hooked on the needles. The needles are my go-to. It's my first line of treatment before I do anything else, because it is so powerfully potent. The more needles I can do on you in the first session, the bigger wow effect you'll have from the treatment, because you will feel significantly better afterwards. Now, usually after the treatment for 2 days, you will feel like a bus has hit you, and if you come to me, it's got my name on the front of the bus. So you've been hit by the Leslie bus, and this bus will make you feel stiff. It really makes you feel like you've run a marathon. It's not your pain that you're complaining about. It is a stiffness pain, a bruised feeling, but there's no bruises on the body anywhere unless it bled. Okay, so sometimes you can get a bruise. It will be a nice, perfectly round bruise, and that's just if I hit a little bit of a blood vessel, then it will bleed. Okay, but otherwise, you've been hit by the bus. It lasts 2 days, and then on the 3rd day, you are significantly better. If you feel really, really bad, so it's exacerbated like 1,000,000 times, it could be that you've actually got a underlying parasite infection, because usually it's not so bad. So I've had 1 or 2 patients that didn't respond well to the treatments, and we then did a parasite and worm detox on them, and 3 months of that, and boom, pain is totally cleared. So we have done a talk on parasite and worm detox. Go and have a squiz for that one. So yes, so there are certain things that cause it. Certain types of people, like your blonde hair, blue-eyed, blonde-haired, thin people, or very fine, small people, they have quite a strong reaction to the needling, and one needs to be careful of the amount of needles that you use. So maybe a maximum of 3 or 4 needles. Okay, that we only know how you respond after the session. If you are known to respond strongly to medication or other things in general, you need to let your physiotherapist know so that they do less needles on you, because otherwise you will have a very strong reaction. And some of the people just pass out here on the bed, they get up and they pass out when they stand up. So there are strong reactions, and that's a parasympathetic reaction. So we have had them all before, so this is how you learn. But if you are sensitive, please let your therapist know. Right, so we've dealt with, okay, so how do I stick the needles in? I've shown you, but where do I stick the needles in is quite interesting. So everywhere in the body you're covered with muscles, and each muscle has a very specific point in it called a trigger point. So when you have that trigger point that is activated, it will refer pain to a specific area of the body. And if you learn in the Simmons and Travels, we call it the Physio Bible. That book, it's a massively thick book, tells you every single muscle, its referral area, its nerve supply, and how it gets activated, how you stretch it out, so that and where to needle it. So when you ask questions in the patient, and I'll do a session on you for you to watch on what questions I ask, is each area, when the person complains of certain pains in certain areas, there's specific questions that one would ask to identify which muscle it is. If they answer yes to certain questions and no to others, then it leads you to one muscle versus the other muscle, and sometimes both are compromised. So, and if one is unclear, or the patient doesn't really know exactly how their pain is, they're just in pain, they can't identify it properly, then one would needle all the areas that could possibly send pain to that area. So that's where you end up doing 30, 40, 50, even 60 needles in a session, just to identify the problem. And also that's when you're doing almost like an IMS type of a treatment, where you're treating the entire body just to clear one area up, especially if they've been suffering with chronic pain for a long period of time. So we would stick the needle into the area that has the trigger point, that's referring the pain to the other area that the patient is complaining about, and they will then get a deep aching sensation. So we spoke in one of the other videos how the needles work, but I'll do it again here. So your needle is made up of a silver section and then a copper that's wound around it. Now because the copper is wound around it, it creates a magnetic current as soon as it's placed into the body, similar to that grade standard 6 experiment that you did with the paper clips and you put the current through it, and then you had the copper wire wound round, and you put a current through, and you put paper clips around, and the paper clips would swivel all to the same direction. So your blood is the current, your paper clips are your P factor, which is your pain factor in the body, and then the needle is the wire, copper wire put around the thing. So you'd put the needle in, the blood would create the magnetic current, and then your P factor would be carried off to an area where it can be excreted by the body, so by your kidneys and your liver. And the muscles then will relax. So as soon as I put the needle into the muscle will grab onto it, which is that deep aching sensation that you experience. If I'm slightly off the point, you won't feel much. I need to be in the trigger point, and then you'll feel the deep aching sensation. And the maximal contraction gives you maximal relaxation. And the third thing how it works is, because I've stuck a foreign object into your body goes, oh my word, something's happened to me, and it sends its soldiers to go and identify what's happening, and you create an inflammatory process which enhances the healing. So that is why for 2 days you are stiff. It's that lactic acid that's been released, it is the blood flow, it is everything, all those soldiers that are in the area that are clearing up and doing cleanup and fixing the area. So that's how it works. So your needles, because it creates a hole into the muscle, a tube, it's basically a tube, and now you've got all these chemicals and these soldiers all working around in this tube that's been left from the needle. You can have an effect for 7 days, so you have treatment for 7 days. So that is why I, as a chronic pain specialist, will treat patients every week, so once a week, so it gives you time to overcome what I've done to you, so get over the bus being hitting you, and then I'll see you next week again for treatment. Your acute patients that are very painful, we can do needles on a daily basis. I would just needle different areas. So if I'm saying, for instance, doing the neck today, I will then do the middle of the back tomorrow and the lower back the next day, and then massage the other areas, so that because when you're in acute, you're in quite a bit of pain, and you can't always tolerate a lot of needles on the first day because your pain is just too bad. So then we'll do little bits, but we can needle the whole area on a regular basis. Just expect the bus to not leave for a week. So yes, so we've covered everything. Usually the first night after the needlings, you'll sleep like the dead. So it has a very powerful, it's again a parasympathetic reaction, and you'll sleep very well. And then that helps to just reactivate your healing process from the sleep aspect of things, so that you can, because when you're sleeping, you're healing. So that's another reason why the needles work so well. I think that's about it. We've covered the different trigger point areas. We've covered why we do needling. Well, the needling, as I said before, it's the most powerful technique. You can eradicate pain instantly. And because it releases the area of tightness almost instantly, you can reduce trigger fingers. Trigger fingers is due to tightness of your forearm muscles, and then it causes a tightness of your tendon here, and then you often have to go for surgery here. If you can catch it in the early phases, you can release the muscles on the forearm, both front and back, and then the trigger finger will deactivate. I had a gentleman that had a claw hand, and we treated his forearm, and his hand was fine after the treatment. It helps. I've had a patient with a locked elbow from doing that hip hop dancing where they jump on their elbows, or the break dancing, and his elbow was locked, and I did the anconius muscle, and as soon as the muscle released, he had full range of movement. Or a gym guy that was gymming too much, he got his arm locked in the 90 degrees position for the biceps. We released his biceps with the needles, and he could release his arms. Ankle sprains, if you've twisted your ankle, I'll show you a video on that in a minute. Ankle sprains, you can use the needles to improve the healing process again, and improve the laying down of your ligaments. You don't do it in the very, very early phases. In the tendon itself, you can do it in the surrounding areas to reduce the swelling. And yeah, I think that's about it. So I hope you've enjoyed the video. If you've got people that are too scared to have the needles, or they say it's against their religion, please forward this to them, because this has got nothing to do with religion. It's all scientifically based. It's linked with trigger points. It's linked with magnetic currents. It's very, very scientifically based, the dry needling that we use. And I've spoken to a number of priests, questioning them, do they have a problem with the needles? And every single one of them have said that if it's for the better of the patient to improve their health, then we do not have a problem with the needles. And I went to all kinds of different religions to do that, because I did have a problem at one stage where the patients didn't want to do the needles because it's against their religion. This has got nothing to do with religion. So do come, don't be scared to come. It doesn't feel like an injection, it's totally different. It's your pain that you're complaining about, a deep aching sensation. Remember, you're going to be sore for 2 days and thereafter feel a lot better. And a lot of patients that were scared of the needles initially, after they see what the needles do for them, they'll phone me up and say, look, I think I need the needles because the stretches and the exercises aren't working anymore. I need something a little bit more stronger. So this really gets into the deep, because it goes deep. It goes all the way down to bone. I put it all the way down to bone, depending on the area that I'm working on. So we release that entire channel that I can't get to with my fingers. So like the video, send it to your friends, come for needling, because it works like a charm. It's the most amazing technique. Thanks for watching. Bye-bye.